Doctor warns, heart attack symptoms. You must know after 50, recognizing a heart attack. Have you ever wondered if your heart, your silent companion through the years, is bearing burdens you've overlooked? As you cross the age of 50, your body is like a book halfway written, with your heart as its most vital chapter. Yet, a heart attack, a dangerous adversary, can strike suddenly, threatening to stop your heart in an instant. Today, we'll uncover the secrets of a heart attack, from how it attacks, its warning signs, to practical steps you can take to protect yourself. Let's embark on this journey, because your health deserves top priority. What is a heart attack? The mystery behind chest pain. Ever wondered why a healthy heart suddenly collapses in minutes? A heart attack occurs when part of the heart muscle dies due to a lack of blood supply. The primary cause is the coronary arteries, the highways delivering blood to the heart, becoming blocked by a blood clot, often formed from plaque buildup over years. Picture the coronary arteries as a river nourishing the heart's fields. When the river is blocked, the fields dry up, and the heart muscle begins to wither. According to the American Heart Association, AHA, over 80% of heart attacks are linked to plaque, formed from cholesterol, fat, and other substances clinging to artery walls. These plaques can suddenly rupture, triggering blood clotting and blocking blood flow. The terrifying part? This process can unfold silently, without warning, until chest pain strikes. Understanding this mechanism highlights why early heart care is non-negotiable. The danger level, numbers you can't ignore. Want to know how serious a heart attack is? Globally, about 7 million people die from heart attacks annually, per the World Health Organization, WHO. In Vietnam, cases are rising rapidly, with a 15 to 20% annual increase, especially among those over 50. Even more concerning, even with timely treatment, 30% of patients face the risk of recurrence within 5 years without lifestyle changes. Men over 50 are 3 times more likely to experience a heart attack than women. But postmenopausal women are also at risk due to declining heart protective hormones. A heart attack doesn't just claim lives, it leaves lasting effects like heart failure, causing fatigue, shortness of breath, and a diminished quality of life. These numbers aren't meant to scare you, but to remind you that your heart needs care today. Risk factors. Are you in the danger zone? Curious about what's quietly pushing you closer to a heart attack? Risks fall into 2 categories, those you can't change and those you can control. Unchangeable factors include genetics, age, and gender. If a close family member has had a heart attack, your risk doubles, per Harvard University research. Age matters too. After 50, arteries stiffen and plaque builds up. Men face risks earlier, but women over 55 catch up as estrogen's protective effect wanes. Changeable factors are where you can make a difference. Smoking is the top enemy, quadrupling heart attack risk, according to the Centers for Disease Control and Prevention, CDC. Obesity, inactivity, high blood pressure, high cholesterol, and diabetes also fuel the disease. A study in The Lancet found 90% of heart attacks are linked to these factors. The good news? You can lower your risk by changing your lifestyle, and we'll explore how next. Symptoms. Listening to your heart's cry for help. Want to know how to spot a heart attack before it's too late? The hallmark symptom is intense chest pain, like a heavy stone crushing your chest. The pain often centers in the chest or shifts left, radiating to the shoulder, left arm, neck, or even jaw. It's not like ordinary pain. You may feel breathless, clammy, with a racing heart and an inexplicable sense of dread. Crucially, this pain lasts over 20-30 minutes and doesn't ease with rest or common medications. Some, especially women and older adults, may experience atypical symptoms like unusual fatigue, nausea, or back pain. The AHA notes that 20% of heart attacks in those over 65 lack clear chest pain, making recognition trickier. So, listen to your body. Any unusual sign deserves attention. Emergency response. Time is gold. Want to know how to save yourself or a loved one during a heart attack? Every minute counts. Call 115 immediately or rush to the nearest hospital. In Vietnam, major hospitals in Ho Chi Minh City and Hanoi offer coronary interventions to restore blood flow within hours. The golden window to save heart muscle is the first 12 hours. Beyond this, the oxygen-starved muscle may die permanently, leading to heart failure or other complications. A circulation study shows survival odds drop 7.5% every 30 minutes of delay. Don't hesitate. Swift action can change fate. Preventing heart attacks, your roadmap to a healthy heart. Wondering how to keep your heart strong in your golden years? Preventing a heart attack isn't complex but requires consistency and awareness. Here's how to start today. Regular screenings. After 50, check blood pressure, blood sugar, and cholesterol yearly. Early detection of issues like hypertension or diabetes can halve heart attack risk per WHO. Quit smoking. If you smoke, stop. 1 year after quitting, heart attack risk drops 50%, says the CDC. Exercise. Brisk walking 30 minutes daily, 5 days a week, cuts heart disease risk by 30% per AHA. Try gentle activities like Tai Chi or yoga if intense exercise isn't for you. Healthy diet. Prioritize omega-3 rich foods like salmon, mackerel, or chia seeds. Greens, fruits, and whole grains provide fiber and vitamins to clean arteries. Limit fried foods, red meat, and refined sugars. These small, consistent changes build a strong shield for your heart. But is lifestyle enough? Let's dive deeper into protecting your heart and uncover surprises ahead. Ever thought your golden years could be your best, with a heart that beats strong and a life full of meaning? A heart attack may be a threat, but it's not your destiny. Next, we'll explore long-term heart care strategies, how to cope if you've had a heart attack, and a surprising secret about the most vital factor for heart health. Keep going. Your healthy, peaceful life awaits. Post-heart attack treatment. Wondering how your heart can recover after a heart attack? If you or a loved one has survived one, it's not the end. With proper treatment, you can still live well and enjoy life. Post-heart attack, doctors often prescribe medications like blood thinners, aspirin, beta blockers, or statins to lower cholesterol and prevent clots. A New England Journal of Medicine study shows sticking to these drugs can cut recurrence risk by 80%. But medication is only part. Combine it with a healthy lifestyle. Managing underlying conditions is key. High blood pressure, diabetes, and high cholesterol are heart attack accomplices. The American Diabetes Association says good blood sugar control can reduce heart complications by 40% in diabetic patients. Work closely with your doctor to keep these in check. Cardiac rehabilitation is also vital. Programs with guided exercise and nutrition counseling strengthen the heart and lower recurrence risk. A Heart Journal study found rehab participants had a 35% higher 5-year survival rate than those who didn't join. Lifestyle changes. Rewriting your heart story. Want to make your later years your brightest? Lifestyle changes don't just prevent heart attacks, they bring joy and vitality. Here's how. Smart nutrition. Treat every meal as a chance to nourish your heart. Omega-3 rich foods like sardines, flax seeds, or walnuts reduce inflammation and protect arteries. Greens like spinach, broccoli, and fruits like oranges or apples provide antioxidants to prevent plaque. Limit salt to control blood pressure. WHO recommends no more than 5 g daily. Regular movement. No need for marathons. Park walks, gardening, or a gentle waltz keep your heart strong. A JAMA study shows 150 minutes of moderate activity weekly cuts heart disease risk by 25%. Stress management. Chronic stress raises blood pressure and inflammation, harming the heart. Try meditation, deep breathing, or chatting with friends. A Yale study found stress managers have a 40% lower heart attack risk. These changes don't just protect your heart, they let you savor life's simple joys. Waking up refreshed, sharing a meal with family, or strolling at sunset. Heart attack versus stroke. Know the difference, act fast. Curious how heart attacks and strokes compare? Both are blood vessel enemies, but target different organs. A heart attack occurs when arteries to the heart are blocked, while a stroke, brain attack, results from blocked brain arteries. Both progress fast and need urgent care. However, the golden window differs. Heart attacks require intervention within 12 hours, strokes within 3 to 6 hours. Per the National Heart, Lung, and Blood Institute, early recognition and action boost. Survival odds by 70% for both. Memorize symptoms and be ready to call for help. The role of family and community. Wondering who's your biggest ally in protecting your heart? It's your family and community. Their support helps you stick to treatment and boosts your spirit. A psychology and aging study shows older adults with strong social support have a 30% lower heart disease risk. Share your healthy changes with family, from better eating to exercise. Join local fitness clubs, yoga classes, or walking groups to connect with like-minded people. These bonds don't just strengthen your heart, they make life richer. Dear friend, protecting your heart is a long journey, but you're not alone. At Senior Health Vista, we're here to provide valuable knowledge, inspiring stories, and tips to help you live healthily and happily in your golden years. If you found this article helpful, please subscribe and turn on notifications to stay updated. Your support fuels our mission to create quality content, guiding you toward better health and a fulfilling life. Together, let's write beautiful chapters for your heart and golden years.